I'm Anthony Wright, and I'm your host today on Attunement. And joining us via Zoom is my guest, Terry Marks-Tarlow. Welcome, Terry.
Well, thank you very much. It's a pleasure to be here with you, Anthony.
And we're going to talk about several things today. The first one about the separation of families and children that's happening from a policy of the current administration. But also, in the second half, Terry has edited a book called Play and Creativity in Psychotherapy. So we'll talk about in the second half of the show. But I wanted to ask you first, and I thought about you right away, Terry, when I first began to hear about this. And you're a scientist in the study of interpersonal neurobiology, right?
Interpersonal neurobiology is the study of how relationships shape the development and formation of the brain, the body, and the mind. So a reductionist way of thinking about the brain and the mind is that the causes the mind, but that's really not, it's much more complex than that. So this is much more about how relationships and what happens emotionally affects development at all levels, including the development of the brain.
Right. And I had read in one of your books, I believe it was Intuition in the Role of Psychotherapy, that the individual arises out of the neurobiological dyad of parent and child. Can you talk to us a little bit about how that works? Because I can see about how when a baby is crying, for example, and the mom comes to hold it or the dad, that there's an external regulation that happens from the parent with the child's neurology. Is that correct?
Yeah, a good way of thinking about it is that compared to other animals, other mammals, we have a much longer childhood, and our children, our infants, are born much more immature. And so it's almost like the baby is still attached to the mother after birth. It's just
energetically, sort of.
Energetically, yeah, invisible lines of attachment. It's true with how dependent babies are on parents, on the primary caregiver. It's not always the mother, but
right.
And for simplicity's sake, I will speak of the mother. And emotionally, the child is completely dependent, and in some ways, emotions are as much a part of the food source as nutrients. Because an infant who is fed and clothed and housed but not touched will die.
Yeah, I remember hearing about that, and I'm just, hearing about these babies that are not allowed to be touched after having been separated from their parents in the immigrants that are coming from the southern border. And I can't imagine. Can you talk to us about what happens with those children, and start with like infants and toddlers and then the older ages of kids when they're not allowed to be with their parents?
Well, it is absolutely a tragedy. And the younger the child, the more severe the problems will be with that separation, because the first 2 years of life are the foundation emotionally for the rest of life and for the rest of development. And the first 2 years of life depend on lots of hugging and touching and kissing and basically secure attachment. And
What is secure attachment?
Secure attachment means that a child feels safe enough in the world and trusting of that safety to be able to both be a little bit autonomous, be interested in play and in learning. On the one
Going out to explore, and then coming back to safety.
That's right, and coming back, being able to come back and touch bases. But the other half of that is is the capacity for intimacy and for relatedness.
I didn't know that. Okay.
So it's both. It's autonomy and it's connection are the two parts of secure attachment, and they go hand in hand. Now, before we really understood about the importance of attachment, and then the first 2 years, a lot of child care experts, so-called experts, especially coming from the British tradition, used to think that if a child was kissed too much and held too much, that they would not develop their autonomy. And so there were practices at the time of John Bowlby, who was the one who invented, if you will, attachment theory. He was only allowed to see his mother an hour a day. And he was sent to boarding school when he was quite young.
Oh my goodness.
He, out of his own pain of separation, grew up to study and formulate attachment theory based on as much on the animal kingdom and monkeys as humans. But attachment is an issue that goes across all mammals. Need to really have secure attachment.
So when these children are taken away from their parents, and I'm sure that the children feel the distress of the energy from the parent in being separated, and that's an additional problem. But so what are the things that, so you said it's a lack of ability to have intimacy with kids who are separated like this? Well,
it depends. The exact age of separation is really important, because where the child is in development will determine what sort of damage results from it.
Right.
But in the first 2 years, for example, there is with any kind of trauma, whether it's abuse, physical abuse, sexual abuse, or abandonment, that kind of thing, it sets a stage for later in life. The problems aren't always obvious. So especially with the early ruptures, later in life, whether it sometimes can manifest during the teen years when there's this huge hormonal shift going on, and psychiatric problems can emerge at that point, or later in life, medical problems. So psychiatric and medical problems go up, the likelihood of them in the earlier the separation and trauma, the greater likelihood of later problems. And but problems can occur. It's not just the first 2 years of life. It's really at any point in childhood that.
So these kids who are separated, like at 2 to 5 or 5 to 10, are still going to have significant problems, significant trauma.
And with this population, just the fact that they have these families have left their family of origin, have left all the people they knew, have no uncertain future, have an uncertain future. they're already traumatized. These people are already traumatized. And so that's the other thing, is you have to look at whether there's a history of trauma. And we could say almost
Oh,
100%
yeah.
there is a strong history of trauma simply because they're there in the first place and looking for a new home and leaving their country. So, and that doesn't even take into consideration whatever relational trauma there might be.
Right. From leaving their friends, and also what's happening between the parents. Is that what you're talking about?
Yeah, yeah. The relationship between the parents and the child may be stressed to begin with. If the parents are extremely stressed, if they're trying to flee for their lives, they're under survival threat. Many of these people are leaving because a relative has been murdered, or they've been personally threatened, and so there's going to be this very, very high level of stress to begin with, which already is damaging to the children, even when they are securely with their parents. Cortisol, which is the stress hormone, when it flushes through the brain, especially early in development, it inhibits the growth of brain cells and it inhibits the connectivity in the various areas. So that's what happens later. The brain keeps developing. We used to think it stopped in around adolescence, but actually the brain doesn't develop fully until the late 20s.
Oh,
And
yes.
I wouldn't be surprised if there are some other ways in which the brain keeps developing beyond that, but the frontal lobes, which are the most important part for executive functioning, for decision making, for judgment, for morality, that's the last part to develop. So,
And that can be inhibited by this very traumatic experience. Is that what you're saying?
absolutely, absolutely. One of the biggest problems after the first 2 years has to do with the connectivity of the cortical area with the subcortical area, and that's really how we learn how to regulate our own emotions. So initially, when the baby doesn't have those parts of the brain developed, the parent serves as almost like the cortex for the baby in regulating the emotions.
Sort of an outside governor, in a manner of speaking.
Exactly. And then when the baby has a good enough experience with having emotions regulated, then the baby learns how to do that for him or herself. But if the baby is left to cry, is left without comfort, the first thing that happens is there's a protest, and there's a high arousal, a sympathetic nervous system arousal. So this is all the autonomic nervous system.
Yes.
That's the fight and flight response. And so the baby will cry and scream and protest. And then if that doesn't get responded to, there's a complete shutdown, which is the parasympathetic response. And when that happens, it may look on the surface as if the kid is all right because he or she is no longer crying.
Oh, they've calmed down.
Yeah, but it's a total shutdown when that happens.
Yeah.
And the danger of that is complete dissociation that can last a lifetime, and is it's almost akin to feigning death. I mean, being that.
So these kids are experiencing a sort of death in their separation.
It is a kind of death in the separation, and it's certainly one of the most pernicious after effects is the loss of trust in people.
Oh, yeah.
The loss of a feeling of safety among people or in the world.
My goodness. Do you have any suggestions about what can be done to remediate this, other than getting the parents and kids back together? I'm sort of at a loss other than, talking with you about this and illustrating what's going on so people can make a more informed decision about it, because I don't know that many people had understood what really happens when children are separated from their parents like this.
I know, in some ways it's scary to think they don't understand, and in some ways it's even more scary to think they might understand and allow it to happen.
Yeah.
Um,
And there's a
what can
form
we
of
do?
othering.
Certainly, the very first step is to get these children back together with their parents. That's the most important. Short of that, whatever most closely simulates a parent-child relationship. So a one-to-one relationship with somebody who really cares would be fabulous. In terms of the literature on this, we have a lot of experience with this kind of thing through adoptions. A lot of foreign adoptions from Russia and China, where kids were institutionalized prior to being given a new parent, has led to an understanding of radical attachment disorder. So a lot of adoptive parents have had to deal with radical attachment disorder, which essentially is kind of the worst case scenario. And so there is a body of training connected to that. It takes a lot of patience for children who have lost their faith and trust to regain it. If they can, it can take years, depending on how severe it is.
Right.
And what the conditions are. As I understand it, some of these kids are being caged. I mean, it's really...
From the immigrant families, right? So what exactly is radical attachment disorder?
Well, it's a child who has not developed really any connection at all. And so there isn't any trust. The children, I think it's very, very individual from child to child. Boys are more vulnerable. Little boys are more vulnerable than little girls. That information is recently coming to light. Alan Shore, who is a mentor of mine, has written a position paper on boys at risk that is getting a lot of attention. And that's because they have two critical periods where testosterone flows, both in utero and after birth. And those are particularly sensitive periods. And so little boys who are struggling, they tend to be more immature than little girls to begin with,
right?
Because they develop later. And they sometimes will protest being held at the very same time that what they need is to be held more even than little girls. And so it can be really challenging. Boys, as they get older, tend to externalize their problems. So they will express it with anger and oppositional, defiant disorder, this kind of thing, throwing tantrums, maybe hurting things, but it really externalizing the problems, whereas little girls tend to internalize. So they might have more depression and anxiety rather than anger and defiant behavior. But,
well, I had sort of a dark humor moment here, thinking about that our president wanted these children to have the same sort of childhood experience that he did. But I don't mean to be unkind, but it seems that this is
yes, abuse begets abuse, and
right.
The more that we learn about epigenetics, which is basically how genes get turned on and off by nurture and by environment, the more we actually are understanding the mechanisms by which abuse begets abuse.
Uh-huh.
So
So that's not so far from being accurate then, it sounds like.
that's right.
Oh my goodness. My. So it's then many of these children are going to foster families, but also then if they go back to their primary families, then there's another disruption.
Right. The more different people, the worse. So best case scenario would be a child gets sent to a foster family that takes care of that child until he or she is reunited with their family.
Yeah.
But unfortunately, I've heard that some of these holding places are like the old orphanages with hundreds of children, and the ratio of caretaker to child being dismal. So I think that there's plenty of time in that at least that initial separation period, that the child is not in a family kind of environment. But there's probably a lot of variability in this. And the other thing is how far from the parents that these children have been taken, because the facilities, that there aren't enough facilities. This is breaking the child welfare system, which was already strained prior to this.
What is the conversation that's going on in the psychological community about this?
Well, everybody is horrified.
Yeah.
Everybody is horrified, and it really is tantamount to abuse, to legislating abuse.
Yeah. So, because last night was watching Schindler's List, the Spielberg film about Nazi Germany, and how children were separated from their families in the concentration camps.
Right.
And the difficulty of that. And I don't know if any studies have been done with those children or not, but I just wanted to have our viewers get a sense from a professional like yourself about exactly what's going on here with these kids, and what, if anything, we can do more than become aware of it and contact people that may be able to make a change.
The other step that might be possible would be to work with the parents at the point that children come back, to work with the parents to inform them about the dangers of these separations and what can be done, how attachment works, and
what to look for.
Yeah, in terms of the Holocaust survivors, there are plenty of studies. I'm not sure they're empirical, but they're certainly case-based kinds of studies on intergenerational trauma, because we see that simply having been in a concentration.
I remember about this. Yes. Continue.
Yeah. Well, simply having been there, even if the next generation doesn't experience a trauma, there tends to be a transmission of the original trauma, because the nervous system of the parent is still carrying all those traumatic features, and that's what the child winds up being exposed to. And some of these parents, some of the Holocaust survivors, don't want to speak about their experiences, and they attempt to protect their children by saying nothing. And in some ways that can make it worse, because when a child starts having symptoms and there is no trigger that they can identify, it makes people feel even crazier than if they know what's wrong, which kind of corresponds to the fact that neglect of babies is actually more severe than direct abuse, because at least there's contact.
Oh, right.
When there's no contact, it's the worst. So same thing, when a child doesn't know why they're having symptoms because a parent isn't talking about anything, then it's problematic.
And they feel the stress from the parent, but they don't have any context for it.
Right, and it affects their bodies and their brain development, and it goes on to a third generation. So there have been with the Holocaust survivors, there are, I believe, some distinctions even between third generational and second generational transmission.
This is just striking, and I think it really brings to the fore about the elicitation of our common humanity, you know,
Yes.
and certainly in all the Abrahamic religions that I've studied, the real key is to welcome the stranger as oneself, you know, because that's really, we are the same being in a manner of speaking. So I really appreciate your talking about this. Any final notes before we go on to the other topic about your new book?
Well, I really appreciate that you wanted to talk about this, because I think the more that people are talking about this and are horrified by it and want to step in and want to help, the better.
Okay. And you have a website, and you've written 4 books now, or 4 or 5 actually.
I have a website. It's my last name without a hyphen, so it's Markstarlow, Marks-Tarlow at Hotmail. Oh no, that's my
that's your email.
That's my email, and the website is markstarlow.com. And all my books are listed in the website, and with links to buying them. And also my papers are as well. And I even have a paper on the epigenetic transmission of trauma, in this case incest, from one generation to the next, and through play as the mechanism. And so, which ties right into what we're moving into. So it's a very interesting paper called "I Am an Avatar of Myself," and it shows how subtle the effects of trauma can be. And in this case, the father of my patient, who's a young lady, the father is the child of a Holocaust survivor. The deepest level of attachment is purely emotional, and it's pre-verbal.
Oh, yeah.
So it's really the emotional exchanges between the therapist and the patient that, and many of those, much of that happens unconsciously.
Right.
Really going on is not even in awareness between the two. But if all goes well, then the story does change
And you talk about that in your book on clinical intuition. Yes,
because the same kind of thing happens with intuition. I get there's what I would say is a myth among professionals and the public that somehow the school, the theoretical school is, and the techniques that are taught are the gold standard of therapy. But really the truth is that a technique without a person who is very sensitively attuned to another person is meaningless. Techniques do nothing. It's really the quality of the relationship, and that's more and more coming into understanding within the profession. And the quality of the relationship is really mediated by intuition, because in the moment-to-moment contact is an intuitive one. We don't think about what we're going to say. We say what we say from the heart, out of the quality of the relationship.
So it's multidimensional.
And it is multidimensional. So there are lots of different layers of interconnection.
Right.
all at once.
Yeah.